go.
Right. Well, celiac disease is the world's most common genetic autoimmune disorder, and it actually affects 1 to 2% of all American people, but it's not very well known. In a press release from February 29, 2012, from the North American Society for the Study of Celiac Disease, they actually estimated that the number of Americans with celiac disease suffering from symptoms but have not been diagnosed might be as great as 3,000, and this is actually just for chronic debilitating situations such as dementia or rickets. Until recently, doctors and medical schools, they've been taught that celiac disease is so rare that they would never see it in their careers. Unfortunately, that's not the case. So as a result, 97% of Americans who have celiac disease, they honestly don't know. They aren't pursuing a diagnosis either. And if you have symptoms, it could take anywhere from like 4 to 11 years to get diagnosed. Hopefully, you have a doctor that would recognize it. They might refer you to a specialist. If not, then most people are getting diagnosed in their 50s at the point. They're actually learning that they have irreversible damage in their bodies and in their brains. Let's see. That was according to the University of Chicago Celiac Disease Center's 2011 research summary. If left untreated, celiac disease could lead to osteoporosis, infertility, chronic anxiety or depression, dementia, epilepsy, other autoimmune diseases such as diabetes, rheumatoid arthritis, and in rare cases, even cancer, usually located in the small intestine. At this point, you might be wondering, okay, what's celiac disease? Why haven't I heard it before? So exactly how would someone know if they have celiac disease? And is there a cure? I'll try to answer these questions in this presentation, and I will be happy to answer any questions that any of you might have afterwards, because I really hope that this information will get to someone that could drastically improve their lives. Learning is what motivated me to go to my doctor and demand that I needed to get tested. Celiac disease is a genetically linked autoimmune disorder. It's passed from parent to child. It is autosomal recessive, so my brother and sister, for instance, they don't have to worry about celiac disease whatsoever. It is technically an autoimmune response, but it only is present when a person ingests gluten, which is an amino acid, or I guess it could be called a storage protein found in most cereal grains. You might have probably heard, I bet, like on the Iams Pet commercial, saying check your dog's food for corn gluten. Corn's fine, potatoes fine. It's specifically brown gold grains. Imagine wheat, barley, rye, occasionally oats, but that's just because of cross-contamination in the fields. In the July 2009 UIC newsletter from their celiac disease facility, Dr. Bara Jabri, I keep mixing it up. She actually stated that from her research, she determines that celiac disease could be found in people that have distinct 2 genetic markers on their DNA, HLA12 and HLE22. So technically, you could have these genes and never develop celiac disease. It is inevitable though, because celiac disease is triggered by a stressful or traumatic event, strangely enough. So researchers aren't sure exactly how it happens, but events such as breaking a limb or losing a loved one or divorce, surgery, pregnancy, because you are putting your body through a lot of stress, catching a virus, or developing a severe bacterial infection that the body responds inappropriately to could actually lead to developing celiac disease. So let's say you or someone you know has the genes and something stressful and traumatic happens in your life. What could you expect? How would you know? What are the signs or symptoms that you should look for? Well, honestly, research in celiac disease is still in its infancy stage. Not very much is known about the disorder, unfortunately. Right now, the Celiac Disease Research Center at University of Chicago and University of Maryland have been teaming up. There are constantly studies that are going on, dozens, and I'm actually participating in one where they're going to be testing the effectiveness of an enzyme that might break down the presence of gluten. Kind of like, all right, well, I'm putting myself on the line for more people. But according to University of Chicago Celiac Disease Research Center's website homepage, they estimate that there could be as many as 7 million Americans with celiac disease. To get kind of more of a picture of how many people that would be, you can imagine 936 full-size ocean liners at full capacity. That would be enough to hold every person in the United States with celiac disease, and people on 980 of those ships don't even know it. Symptoms that most doctors recognize as indicative of celiac disease just from their outdated texts and their instruction, and from just being in the field with these old practices in mind, they usually recognize digestive systems. If there's any abnormalities that are occurring there, such as bloating or abdominal pain or distension, where you actually like your abdomen drops, it looks very strange, or chronic diarrhea or constipation, that could also just be mistaken for nosocomial infections happening in the hospital. Well, as an example of just how radical this disease is at affecting people, I was diagnosed in April 2008. I was still serving in the Air Force at the time, and well, I went to a gastroenterologist and I demanded to be tested. But this is only after months of experiencing just like symptoms such as chronic fatigue and mind fog, vomiting from acid reflux, painful muscle spasms that just randomly popped up whenever I was asleep or awake sometimes, severe depression and anxiety, joint pain. Most of it was like in the wrists, knees, and hips, but that's just from like occupation. Anemia and bloating, diarrhea and constipation, chronic migraines, severe nodular cystic acne, and highly abnormal blood tests due to malnutrition. I actually got sort of a copy of my CBC result where they'd drawn blood, they looked at just the diagnostic picture of my red blood cells, white blood cells. I was pretty close to getting admitted to the hospital for blood transfusions because I was so low in iron. So like, if you or someone you know goes to a doctor and you get diagnosed with celiac disease, what's the picture for you? And what do you do at this point? Because it is a life-changing diagnosis. There's a lot of things like eating habits and sleeping habits and just general lifestyle habits that you have to modify to accommodate for this disorder. There's no cure yet, unfortunately, but there are actually lots of commercial companies who are fighting it out to try to find a cure. They want to find a vaccine. They're pretty much motivated because they know of the high potential number of patients, and there is a company called Immunotech. They are claiming that they have a vaccine that cures the body's immune response to gluten. I wouldn't necessarily trust that. For patients that do have celiac disease, the good news is you can prevent the signs and symptoms of celiac disease from progressing further, maybe even turn back the clock if you stick to a strictly gluten-free diet. When I'm seeing gluten-free on food products in grocery store aisles, they're becoming a lot more common now, so it's actually a lot easier. There's absolutely no cheating on the diet because small amounts of gluten, even as much as like 20 micrograms, could affect a person with celiac disease. A good picture of a microgram is if you take if you look at just a piece of hair and you take the width and you cut it down to maybe 100, it's probably smaller than that. So usually patients that have to eat gluten-free, they have to avoid just products like wheat, barley, rye, oats, and anything that might be made from those grains, such as MSG or modified food starch, if it's not mentioned specifically. Just right now, research for gluten testing in foods is also in its infancy stages. There's a lot of do-it-yourself at home kits that are available saying, take some of this food, smudge it on this pad, put a few drops, and it'll let you know if there's gluten. Well, there are a lot of false negatives, false positives. It's not entirely a reliable system, but the technology is getting there. There is actually some analyzers that you can bring home. Granted, they're really expensive, that you could actually test for the presence of gluten. And the University of Chicago Celiac Disease Center, they're coming very, very close to having an actual mouse model of the disease, which they would be able to test. They would be able to test like effective treatments on it, see if perhaps they can inhibit this specific immune response, or maybe break down the presence of gluten entirely so the body doesn't recognize it. And actually, I would really prefer that. Since you know like a little bit about celiac disease, I'm hoping that if someone asks you, you'll be able to tell them that it's first an autoimmune disorder. It is inherited. It is more common than believed. Would be that there are many symptoms that could be attributed to celiac disease. Right now, the running list is about 300. If you look on there, then it's greatly varied. It would be very difficult to actually pick out this person has just the symptoms for Crohn's disease, or just for autism, for rheumatoid arthritis or fibromyalgia, and say you will get better if you start eating gluten-free. And then, well, of course, then the third point is you have to stick to a gluten-free diet. Sometimes you may experience episodes, it's called refractory celiac disease. At this point, researchers aren't sure if their results are getting altered by the fact that maybe these people are accidentally ingesting gluten again. They're not being very careful when they're eating out either. But it could also potentially be that this is just celiac disease that's not responding to a gluten-free diet. In this case, a need for a cure is perhaps greater than ever. And we don't really know the patient demographics until more people are diagnosed. So if there's any possibility that you might know some celiac disease, it would probably greatly benefit them to learn about this. I found I was just surfing online, and when I looked at a list of symptoms, at the time it was very small, it was just a dozen, but I looked and said, okay, that looks just like my mother, and they were actually just giving a worst case scenario. So, okay, well, it's diagnosed. That's when we actively pursue diagnosis. My mom's coming around to thinking maybe she might have it. For the longest time she was saying, you know what, I remember my mom having difficulty flying. You probably got it from her. It isn't really switch generations. To get a better idea of exactly what celiac disease does to the body, in the intestine itself, you have little protrusions from the walls of the tissue. They're called villi, and they're there so that your body can absorb as much nutrients as possible. It's creating more surface area. And malnutrition in celiac disease is actually a result of the villi getting destroyed, because the immune response, when they're attacking gluten, they usually attack it after it's entered the intestinal wall. So it's not a specific response either. It says, here's gluten, we'll destroy this and everything that's nearby. Pull this picture. And this is from the Mayo Clinic. this is a healthy intestine. This is a intestine with celiac disease. And sadly enough, this is not dramatized. If you have healthy intestine, then you have all these villi-like protrusions, and then these little areas are called crypts. But if you have celiac disease, it's pretty much like wiped out the villi. The doctor will see this when they do a biopsy for confirmatory testing. And what they would notice these crypts is the crypts, they're not as deep. That is actually just a result of your intestinal texture changing a little, but then also you actually have this a gross, like strange, large mass of accumulated white blood cells sitting in here. If they actually sit there dormant enough, they could technically cause ulcers. And when they're doing the biopsy testing, that's what they're actually looking for. If they see villi that's been wiped out, there could be several other causes for it. If they actually see some sort of ulcer or pitted and spotted kind of lace-like structure of the intestine from the top third half, then that would be more indicative of celiac disease. The antibody test, it really was not all that bad. They just drew blood and they saw that I had high levels of antibodies, just IgG, and just 2 types of IgG antibodies that were definitive markers of celiac disease, because my body was responding to the presence of that in my system. Once you get the screen, then you can get the biopsy. I highly recommend getting the biopsy for that, because most doctors, if you have to change clinicians, they probably won't take the disease seriously if you haven't had confirmatory testing. And if they want to do further testing, you'd have to go back to eating gluten. It's called a gluten challenge for at least a month. And that might be a miserable month, but you'll have the antibody screen, and then they might move forward with their testing. But I really, really encourage you to share this information with as many people as you can. If you think of the rate of incidence, since the National Association, since the North American Association for Celiac Disease Research, they had stated that 1 in 130 people might have celiac disease. I want to give you these numbers to kind of keep in mind further. In studies that covered pretty much every patient on the eastern coast from February 1996 to March of 2001, that was conducted by the University of Maryland. They drew blood from patients. They just added this extra tube for their testing, and they found out that patients who were seemingly healthy, they had absolutely no symptoms, the rate of incidence among them was 1 in every 133. If you have family that is first degree, your brother, sister, parent has celiac disease, you have a 1 in 36 chance of having celiac disease. And if you are a second degree relative, or you have symptoms that are present, and it could be just that, or it could just be IBS, you have a 1 in 20 chance for celiac disease. If you guys are interested in any more information, there's a website, cureceliacdisease.org, that is run by the University of Chicago. I also have fact sheets for diagnosis, for testing, so you can actually learn more about the biopsy and screening. And then just some interesting facts and figures about just the prevalence of celiac disease in the nation, and exactly what demographics that they are more commonly affected. So, is there any questions?